This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. You know, May is American Stroke Month, and our next guests want to help us know how to spot and prevent a stroke. We welcome Providence neurologist Dr. John Zurasky, along with stroke survivor Jack Strayer and his wife Linda, who spotted the signs of his stroke. Welcome to all of you. Now, let me first start with you, John. So, what was happening when you were, Jack, when you were sitting there? What was happening for you before your stroke came on?
We just got up from dinner about 6 o'clock. And sat down on our easy chairs to watch some recorded comedy that we like to watch.
Oh, that's
in the
like
evening.
me and my husband.
And so I just got it dialed in, and all of a sudden the room started to spin.
Oh, wow.
And I told Linda that I just wasn't right. And so we turned the TV off, and she looked into my eyes. She said she didn't see anything abnormal. But then in about a minute or so, it came back, and it was really severe. I had never had any pain, but it just like somebody hit me with a 2x4. You know, it
Wow.
just totally debilitating.
Linda, what did you see?
Just that he was kind of panicking. He was saying, I'm not right, I'm not right.
Right.
And so I couldn't see any indication of him having a stroke or anything. So I said, okay, I'm going to call 911. And that's what I went to do.
And Jack, you said, so the room was spinning. You felt like you'd been hit by a 2x4. Anything else? Did he sound okay when he was talking to you?
Yes.
Well, for a while, my speech was okay. And then after a few minutes, it got slurred, and my right side of my body went limp.
Wow. And so...
But the interesting part was when we got home, we compared our stories. And she had a little different story about, I thought I was conscious the whole time. Saw the EMTs come in and all this other thing, went right to the hospital and things. But she said a little different story.
Linda, what was a whole different story?
Well, there were just things he didn't remember.
Like
So
unconscious and stopped breathing?
yeah, like when he when he quit breathing.
When he quit breathing.
I became
I
paralyzed.
forget that too. Wow, so he became paralyzed.
Yes.
Oh, wow.
So while I was on the phone with 911, and she's saying, you know, get him on the floor so you can do chest compressions. Can you imagine getting him on the floor?
Right, right.
So I said, can't do that. So we reclined him back, and I was doing chest compressions, and that's about the time that the firemen and the EMTs came.
Doctor, talk to me about what a stroke is exactly.
So a stroke is a blood clot blocking flow in an artery to the brain, and the symptoms that come from it are determined by the part of the brain that's not getting the blood supply at the time.
And how dangerous is having a stroke?
So it's terribly dangerous. It can be, this is really fortunate, it can be extraordinarily debilitating.
Is it fatal?
About 15% of the time it can be.
It can be.
So
Can you be left paralyzed?
you can be left paralyzed on one side or the other. You can be unable to express yourself with language. You can be unable to walk again. A lot of different disabilities depending.
Is the key getting medical help as fast as possible?
As fast as you get, the earlier you get treatment, the better chance you have to get out of this with few deficits as possible, or like Jack, maybe no deficits.
And Jack, you're feeling good now.
Oh, yeah.
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 Okay.
I'm just really extremely tired, which I guess is a normal symptom.
Right.
But I got to the hospital within half an hour, because I remember seeing the clock at 6 o'clock, and when I got to the hospital and in the triage room, it was 6:30.
Wow.
So it was really interesting, yeah.
So you have an easy way for us to remember
Right.
how to spot a stroke, and it's called
Right, so
Be Fast.
The anagram is be fast. It's balance, eyes, if someone's eyes are moving funny, if they have a facial droop, if the patient's arm can't lift, if their speech is a little bit off, then the T is for time, trying to put into place the go fast, fast, fast if you're having a stroke, or someone you know is having a stroke.
So would you suggest to someone, can you walk for me? What would you
know,
suggest?
In your case, you know, you would ask somebody to smile for you, hold their arms up for you, and just try to have a simple conversation.
And how can you possibly prevent a stroke?
So there's lots of ways to prevent a stroke. If we manage our blood pressure well, if we don't smoke, if we have diabetes, manage good glucose and give your cholesterol a good check and make sure you're optimizing your management of it, it reduces the likelihood of stroke greatly.
So exercising, diet, pretty much everything we've all heard before, right?
And good sleep.
And good sleep, and that helps.
Yep.
Have you changed anything up, Jack, in your lifestyle?
I exercise quite a bit, and we try to eat fruits and vegetables and stuff, but I'm trying to get the exercise
Right.
back in routine.
Okay, and what are you doing to treat your wife since she saved your life? Are you doing anything, taking her out, taking her on a cruise, anything like that? Linda, what would you like? I'm
I'm just
helping
grateful he's here.
Yes, okay. Well, there you go. All right, that's wonderful. We want to tell folks if they'd like to find out more information about preventing and surviving a stroke, head to the Family Matters section at KATU.com. Click on Features and then on Family Matters, and there you'll find the information you need. And Providence also has a stroke assessment tool on their website, so we'll link you to that as well. Thank you all very much. And Jack, I'm glad you're doing well. That's awesome.